In this video I'll show the easy way to treat trigger points in your low back. Now if you have any sort of long-standing back pain, trigger points will be a big issue. Now even if there's some other cause like say a disc injury or an arthritic joint, they'll still be there, adding to the pain, stiffening your back and even causing things to lock up. Now with the techniques I'll show you, there's been no painful pressure or getting into awkward positions with balls, no needles, no lasers and no forking out for ongoing appointments. Now it's something you can easily do yourself and it's as effective if not more so than any of the professional therapies. Now the way we'll do it is with a vibration massager. Now I'll link the technical stuff, but simply what you do is place the head of the vibration massager over the trigger point. Now the vibrations penetrate deep into muscles, basically dissolving the trigger points. That works extraordinarily well and there's no pressure to cause pain or potential injury and none of the risks associated with needles. Now in this video I'll go over the basics you'll need to find trigger points and do a really good job. Then go over the specific muscles of your low back. Now first, how do you find the trigger points? Now I'll demonstrate on my forearm so it's easy to see. Now the basic technique is use the pads of your fingers to do a general examination. Then if you find an area that's a bit tender or tight, use the tips of 1 or 2 fingers to examine a bit deeper, looking for tight bands of muscles with a tender lump that shoots pain. Now they're the trigger points. Now that said, it's nice to be able to find the trigger points and then recheck to make sure they're better, but the reality is that you don't even need to. Now, you need to find them accurately if you're using pressure or needles, but with something like one of these, if there's a trigger point anywhere under the head, the vibrations will find it. Now with that in mind, there's charts like these that show where the common trigger points are. You can just go over those, or you can just do the whole muscle and you're guaranteed to get them all. Now easier still, once you've used the massage a few times, you'll even be able to feel when the vibrations hit a trigger point. Now when you can do that, all you need to do is systematically move the massager over the muscle, and if you feel the trigger point, stop the machine and let the vibrations take care of it. Now let's look at how to use the machine. Now I'll link full instructions and precautions but give you the basics here. A standard disclaimer, this video is not specific advice, just general information to be discussed with your own healthcare professional. So what you need to do is just sit the machine on and let the vibrations soak in for 30 to 60 seconds. Now there's no need to do any of the conventional stuff like pressing in or moving the machine around. In fact, that'd be counterproductive. Now obviously if you move the machine around, you're not letting the vibrations soak in properly. Now for hygiene and to avoid skin irritation, use the machine over cloth or clothing. And to make it really easy so you don't get tired, you have the part you're massaging horizontal. That way you don't need to hold the weight of the way the machine applies the pressure. Now lastly, have the muscle relaxed. Now the massager can't relax the muscle if you've got it tightened. And that's one of the reasons why results from foam rollers are generally so poor. When people use them, they're often tightening the muscle that they're trying to massage. Now, next we'll look at what machine to use, what settings and what heads. Now to get the proper therapeutic vibrations, you'll need a genuine vibration massage, not a massage gun. Now they don't deliver anywhere near the amount of therapeutic vibrations, and because they drive the heads in the muscle, they can easily do a lot of damage. Now people have nearly died from internal bleeding after using them. Now I'll link how to choose the right machine, but I don't want you hurting yourself, so I'll quickly show you the difference. Now looking at this diagram, the machine on the left is a genuine vibration massager. Now you see it has a contact pad that sends in large amounts of vibration. Now the tool on the right is a T-bar, which massage therapists use to apply deep and painful pressure. Now massage guns are basically T-bars with a jackhammer mechanism to help drive the head in. Now you can see the massage gun delivers a lot less of the therapeutic vibrations, which means they're not going to have the effect on the trigger points, while driving the head in like a jackhammer can potentially do a lot of damage, especially if you get the things like nerves and blood vessels. Now, massage gun marketers are very misleading. Now they'll tell you that the vibrations have excellent benefits, but they won't tell you that they deliver a lot less of those than a proper machine. Now they'll tell you that driving the head increases penetration, but it's the vibrations that do the work and they go much deeper. All driving the head in does is potentially hurt you. Now next look at how to set the machine up. Now the therapeutic vibration ranges from 30 to 60 Hz, which is cycles per second. I like to use about 50, and that's really comfortable and seems to get the best effect. Now, a lot of machines give their speeds per minute, so 50 is 3000 RPM. Now, if you use one of our general purpose massagers, their top speed is around 60 Hertz, so what I do is back it off about 10%. Now, if you've had massage has different heads, just remember it's the vibrations that do the work, and driving the head in the muscle can potentially hurt you. Now, with my machine, I use the flat head most of the time because it's comfortable and sends in the most vibrations. Now, we've got a smaller head. Now, I don't use it for extra penetration, but rather to get in some places that the flat head won't get to, like the arch of my foot. Now, to get really good lasting results, if you've had trigger point therapy before, you can have courses of needles or laser and massage type therapy. Feel good for a while, but the pain eventually comes back. And that's because trigger points are usually been there for a while and can be very stubborn. Now, the treatment stops them hurting, but it doesn't get rid of them. Now, what you need to do is keep working on them after they've stopped hurting. Now, keep the treatments going until you can't feel them anymore when you examine them or the machine runs over them. Then maybe once a month just to keep them at bay. And that's very easy if you've got your own machine, so you're not making appointments and not forking out all the time. Now, one last bit of general advice I'll give you is that trigger points are often part of a more complex musculoskeletal problem. Now, you can do this therapy yourself, but if there's any doubts or the problem keeps reoccurring, don't hesitate to get some advice from a professional who deals with these sort of problems, such as a chiro, osteo, or physio. Now, that said, there's a lot of advice and treatments that are a bit dubious, so what I first do is check out the article I've got linked. Now, that'll give you a bit of background so you can suss things out. Now, with that, let's show you how to find and treat all the trigger points in your low back muscles. Now, the first is the paraspinal muscles. Now, they run down each side of your spine and there can be trigger points almost anywhere along them. Now, unless you're Inspector Gadget, you won't be able to examine them yourself, and you'll need a massager with a decent handle. Now, remember I said it's good to have the part you're massaging horizontal, so the part holds the weight of the machine and gravity applies the pressure. Now, the most effective way to do that is lying face down, as you can see in this video. However, I'll demonstrate here using the alternative method of bending forward, supporting the weight of my trunk with my elbow on my knees. Now, as I said, it's very difficult to examine these muscles yourself, so what you do is go down each side, systematically stopping 30 seconds on each spot. Or, once you get used to using the machine, and you can feel when the vibrations hit a trigger point, you can use the machine slowly and stopping for 30 to 60 seconds if you feel anything suspicious. Now, if you've got one of our quad head massagers, it's really easy. You sit the spine in between the heads like this or like this, depending on which way you're holding it. Now, it does a good section of your spine both sides at once, so it just takes a couple of applications to do your whole low back. Or, if you like, you can easily use a machine like a chair or a cushion massager. Now, the next muscles we'll look at are the quadratus lumborum muscles. Now, as this pic shows, they sit deep each side of your low back. Now, they're a big cause of back pain. Now, unless you're a professional, you won't be able to feel the trigger point. So the best thing you can do is give the muscles a really good soak with vibrations. Now, to get to them, you move the head out about 6 centimeters from your spine and then angle it about 45 degrees so it's pointing towards your spine. Now, in the video you can see me doing it lay down, and because of the angle I'm half sideways and half face down. The easiest way by far though is if you have one of our quad head massagers. You just sit the machine on a chair behind you like this with 2 heads on either side of your lower spine. Now, I do that each morning when I'm going through my email inbox. Now, if you do that though, try and have the pressure on the massage about the same as if you were using it normally. Now, there's no advantage in using extra pressure and it'll just overheat the machine. Now, you can leave the machine doing that for a few minutes. Now, the vibrations are good for you and it will soak the spots that need it. Now, the next muscle we look at is the iliopsoas muscles. Now, as these pics show, they sit at the back of your abdominal and pelvic cavities. Now, they can cause pain in your back and the front of your thighs, and this is often worse with prolonged standing or standing up from a deep chair. Now, there's a lot of sensitive structures overlying these muscles, so it's best to leave these to a professional or at least have one show you how to do it safely. Now, the next ones we'll look at are your glute or backside muscles. Now, in your backside you've got 3 glute muscles and a heap of others, including the piriformis, which a lot of people might have heard of. But you don't really need an anatomy lesson. Now you know where your backside is, and there's muscles on the side right round the back until you get the bony bit called the sacrum. Now you've got muscles near the surface and very deep ones around the hip joints. Now you just need a systematic way to do them all, and this is where vibration works really well. Now the easiest way is to start laying on your side, so using the weight of the machine. Now work systematically to do them all, and as you work towards the muscles further to your back, roll forward and keeping the part that you're working horizontal. Now if you feel the vibrations getting into something tight, let the machine sit there for a bit longer, maybe 90 to 120 seconds, and let the vibrations soak into the really deep spots. Now in the demo I was using our single head general purpose massager, and if you've got a quad it'll do a great job, and it'll do it faster because it's doing a bigger area at once. Now the last muscles I'll show you are probably the most important, and that's the small muscles pictured here that sit around your spine. Now they're probably one of the biggest reasons a lot of back problems don't get better, and I'll show you why. Now you can see from where they are that they're very important in moving your joints around and holding them in the correct position. So problems with them can easily upset the balance and movement of your spine. Now the other issue is that most therapies you get ignore or can't do anything about them. So why is that? For a start, they're so deep and hard to get at, you can't feel them to examine them. Now second is, even if you could, most therapists can't get to them and treat them. Now there's no way conventional massage therapists will get their fingers or a massage tool anywhere near them. Now you technically could get to them with a needle, but acupuncturists and dry needlers would never do that because it'd be way too dangerous. Now you'd end up sticking a nerve, a blood vessel, or even your spinal cord. Now on the other hand, vibrations can easily soak in and get to them. Now in practice, the same techniques I showed you for quadratus lumborum will soak into the intrinsic muscles. Now that said, I'll show you how a professional like myself would do them. Now it's something you might be able to do with your own professional. Now we can't examine the muscles directly, but we can examine them indirectly by checking the movement of the individual joints. Now we find that one that's stiffened is most likely that the small muscles that control it are tight. So we can put the machine directly over those muscles, and then when we recheck, the joint's usually a lot less stiff. Now this helps your spine immensely, but as I said, it's something you'll need a professional to help you with. So they're all the massage techniques you need to know. Now once you've done them a few times, you'll work out a system and be able to do them very thoroughly in a matter of minutes. Now lastly, as I said, you need a genuine vibration massager. Now a lot of vibrating massages are not serious therapeutic devices, and as I said, massage guns don't deliver the proper therapeutic vibrations. And that said, genuine vibration massages are not that common, and most are designed for professionals like myself to use on patients rather than for self-use. Now I'll picture a couple of examples here. Now because of that, we build our own personal use vibration massages. Now this is our general purpose massager, and the business end delivers copious amounts of therapeutic vibrations, and it's got a proper ergonomically designed handle so it's easy to use anywhere on your body, and has very easy to use controls. The on and off switch underneath and variable speed control under your thumb. Now, over the years we've sold over 100,000 of these without any advertising, mainly through professionals like chiropractors, osteopaths and physiotherapists using them and recommending to their patients. Now more recently we've developed our quad-head machine that has all the good things of the general purpose massager, but can do a much greater area at once. And because the front part is larger and flatter, as you've seen, you can easily use it like a chair or a cushion massager. Now, for more information on using vibration massages or our machine, please see our website or the description. Now, if you have any questions or comments, please don't hesitate, and thank you very much for watching. It's been most appreciated.